Hello and welcome. I'm thrilled to share with you today my deep passion for anatomy and physiology and why a solid understanding of these subjects is absolutely essential in the field of vestibular medicine. So let's start with a simple truth. We start with a deep discussion of anatomy and physiology because if we don't understand normal physiology, how can we possibly grasp pathology? By delving into the specifics of vestibular anatomy and physiology, we lay the groundwork for identifying and managing vestibular disorders effectively. In Lesson 1, the topics of discussion are to best understand how the vestibular system works, which allows us to appreciate its role in maintaining balance and spatial orientation. This knowledge is crucial for diagnosing and treating conditions that affect these functions. In this lesson, we cover the role of the vestibular system, peripheral components, vestibular and cochlear mechanisms, innervation and blood supply, central connections and mechanisms, practical physiology of balance, and neurophysiology of vestibular compensation. Understanding the anatomy and physiology of the vestibular system, including its associated pathways, is essential for identifying the cause and, in most cases, causes of vestibular-related deficits. Why is this so important? Because imaging techniques often have low sensitivity when it comes to detecting vestibular issues. Traditional diagnostic methods typically do not explain functional impairments accurately. It is equally important to understand the neurophysiology of vestibular compensation after injury, disease process, or other mechanisms of dysfunction. This knowledge allows us to establish the most appropriate care plans aimed at achieving optimal patient outcomes. Moreover, a deeper understanding of these systems enables us to comprehend associated symptoms such as motion sensitivity, spatial orientation issues, and even cognitive effects more effectively. Experiencing imbalance can be a common issue for many patients, even those who don't report dizziness or vertigo. Balance is a multifaceted and fortunately highly adaptable control process. To truly grasp a patient's balance impairment, a thorough assessment approach is necessary, one that systematically examines all components and their interactions under various task conditions. This comprehensive examination will be covered in almost every lesson plan. While in Lesson 1, we take a deeper dive into the essential biomechanical, sensory, and motor components of balance, laying the groundwork for effective understanding and management. We will continue to revisit these concepts throughout the CCVR course. So I hope you learn to love vestibular anatomy and physiology as much as I do. Thank you for joining me in this brief video, and hope you can join me for our next one, where I'll cover the content in Lesson 2, Vestibular Diagnostics, a closer look at VNG, VIMP, and VHIT.